When I talk about narcissists, which is primarily what I talk about on this channel, a lot of the information can also be applied to someone with borderline personality disorder, and that's what I'm going to assume you're referring to with BPD. So, borderline personality disorder is a personality disorder the same way that narcissistic personality disorder is. And those two disorders, without going into too much detail, are part of the same category in the book that psychologists and other mental health professionals use to categorize a certain cluster of symptoms. So there's narcissistic personality disorder and there's borderline personality disorder. There's a lot of research to show that borderline and narcissism are actually probably the same disorder that is just presented differently in men and women based on cultural norms. And so there is often a lot of overlap between those things that are done by a narcissist and those things that are done by somebody who is borderline. And if you think about it in common culture, most often, men are diagnosed with narcissistic personality disorder and women are diagnosed with borderline personality disorder. And so that's where the research is kind of looking at why that is and suggests that they could potentially have the same underlying features, but how they present themselves, which is ultimately what a diagnosis is based on, a mental health diagnosis is based on, how they present themselves is different because of cultural norms within the US. So when I talk about things that are related to narcissism, they very much can also apply in a lot of situations to borderline personality disorder, because there are a lot of similarities between those two conditions, and so they will look the same oftentimes.